Heidi Beidinger for Indiana 5th District Representative. This is not your first time running, right? This is your second time.
That's right.
So for those who don't know you and don't know that you ran before, tell the voters who you are and what you're about.
So my name is Heidi Beidinger, and I'm a lifelong resident of South Bend. I was born and bred here. And my mom and dad are immigrants to the United States. My mom was actually born in the Netherlands, and my father was born in Austria, and they were raised there during World War II. And in the early 60s, they migrated here to the United States, and they actually met at a bowling alley, the Chippewa Bowling Alley on the south end of South Bend, and fell in love and had my sisters and I. I've got 3 younger sisters. And our life was about centered on family and community. And we grew up with stories about World War II and what that was like. And so my mom and dad, all the stories we ever heard were about family and community and taking care of each other. So that's what I bring to this role now in my run for state representative, is family, community, and that we take care of each other. And everything that I've been talking about, and when I'm knocking on doors, these are the things that people want to talk about.
Now, a big issue both at the national level and here in Indiana is abortion. So I want to talk about, in August of 2023, the Indiana Supreme Court decided that the Senate Enrolled Act 1 could go into effect, which eliminated the licensing for abortion clinics. What can you do if elected to, you're going to be up against a Republican majority, most likely, so how do you affect change when it comes to abortion rights here in the state?
Yeah, it's a really good question, and the change is going to be slow. I'm not going to sugarcoat it. It's going to be a difficult journey for us to restore women's rights. Except I will say this, is that Jennifer McCormick, who's the Democratic candidate for governor, is running, and she is running on restoring women's rights. If we elect Jennifer McCormick, and you elect me, and you elect other Democrats who want to restore women's rights, we can make things happen much more quickly than if we don't elect Jennifer McCormick. And the truth is that Mike Braun and Micah Beckwith, who's his running mate, the 2 of them who are running governor and lieutenant governor, have a really extreme view of women, as well as my opponent, Dale Devon, has a really extreme view of women. And this is what we've been talking about, restoring women's rights. And the thing is that the vast majority of Hoosiers want women's rights restored. They want access to some abortion health care. As a result of what has happened here, well, let me go back a moment and let's talk about that time in 2023 when Indiana passed one of the most extreme abortion bans in the country. Governor Holcomb called the legislature back into session, and they passed one of the most extreme abortion bans. There was an amendment that was offered, and Dale Devon voted in favor of that amendment, and that was to eliminate the exceptions for rape and incest. This is so extreme, and it didn't pass, thankfully. But we still have one of the most extreme abortion bans here in the country. And they were so excited about this abortion ban. Do you know that Governor Holcomb actually signed that bill in the middle of the night on Friday night after they signed it? It was 3 a.m. behind closed doors. No fanfare, no media, because they knew how extreme it was and how unpopular it was. This is one of the centerpieces of my race and my platform, is restoring women's rights. And we can do it this year. We have many terrific candidates in the state of Indiana, and we can actually restore women's rights. We need to elect the right people who are going to do that.
It's going to be an uphill battle, whichever way. You will most likely still not have the majority. So what are some things that you could do, or some compromises that you could put in place with the Republicans to get them to join to restore the abortion rights?
Well, I think we got to look at the data, right? So we need to start examining what's happening as a result of this extreme abortion ban. Okay, so here in St. Joe County, do you know that we have half as many OBGYNs practicing in St. Joe County than we did 5 years ago? Where are the OBGYNs going? Well, they're worried about their licensure. They're worried about their fate, about going to jail and to prison, and rightly so. There's a medicine specialist called a maternal fetal medicine specialist who works with moms who are at high risk for their pregnancies. 2 years ago, we had 5 of those in St. Joe County. We have 1. So if your pregnancy is at high risk, you're going to be asked to travel someplace else. And you're going to have to travel a distance at your cost, right? If you're at work, now you're going to have to take off work to travel and so forth. So when I think about, like what you're talking about is making these incremental changes, we have to look at that data. They're actually putting women's lives in jeopardy. And we've actually already had a death in Auburn, Indiana. A young woman, 26 years old, died of an ectopic pregnancy. That's totally preventable. It's inexcusable that in America that a woman is dying of an ectopic pregnancy. I believe that there are reasonable Republicans who can look at that data and say, this is crazy. We have to change this. There's also other data. We have 92 counties in the state of Indiana. 32 of them do not have a place to deliver a baby. We need to provide space for women to have babies, to have families to have babies. When our infant mortality is one of the worst in the country, and our maternal mortality is one of the worst in the country, that is a signal that the policies that we've passed are wrong for Hoosiers and Hoosier families, period. So those are the things that I would be centered on. It's the data, it's the hard facts. The Republicans have said that they want healthy families, healthy babies. Well, then let's do that, because otherwise you're putting families in jeopardy. So it's to have those kinds of conversations and build coalitions. And that's something that I've been doing my whole life in public health and public education. When I'm working on solving problems and improving things, implementing new programs, you have to build coalitions, right? You have to have compromise and discussion and so forth and work together. And that's what I intend to do when I'm there.
That word compromise you just used, certain states around the country that are Republican controlled have come to some sort of compromise with a certain amount of weeks involved with abortion. Is there some sort of time frame, trimester, that's too late to perform an abortion?
Well, so there's this whole thing, this business of too late. That's a myth. That's a fallacy. There is it doesn't exist. When we have, my opponent talking about late-term abortions or abortions after birth. Abortions after birth is called murder. So that is not a thing in America. I'm not going to debate. I'm not a medical doctor. I'm not going to debate like what week is too short or too soon, whatever that is. I want to restore women's rights. And I want women to feel comfortable that they can have access to high quality care, that they can get access to a specialist when they need it, and that they know that they're being taken care of with a high quality healthcare system. And that is not what is happening in Indiana. Dale Devon passed an extreme abortion ban that's putting women's lives at risk.
You just mentioned healthcare, and that brings us to the next question. Reports indicate that Indiana is ranked in the top 10 worst states in regard to healthcare. State-based public health spending is below the national average, okay, and is lower than it was back in 2012. The amount spending per resident here in the state is lower than it was in the state back in 2012. So how do you plan to help improve healthcare for everybody?
Yeah. That's probably the million-dollar question, isn't it? I'm thinking the best way to answer that question, and how do we improve healthcare?
Well, public spending for residents has gone down, and there's less spending by the state. Is more money the answer if you get elected to the state?
Is more money the answer? I'm going to say that yes, we have to invest more money in healthcare here in Indiana. Indiana took a really long time to come on board with the Affordable Care Act and the expansion of Medicaid. We have over 40% of our families who are using Medicaid. So we have to make sure that folks are still getting access to that. And the thing is, even with those expansions, people are still not able to access their doctors for preventable things. People are assigned doctors that are like across the town from where they live. Why are we doing that to people? Why are we making it so difficult for people to get access to preventable care? Prevention right? I mean, it's an old adage, but it's an ounce of prevention is a pound of cure. And so why are we not investing more in prevention, right? So when we're talking about how we're going to improve healthcare, I want to talk about access, right? It's here in St. Joe County, we have healthcare, but we have people who don't access it because it's too far, it's not convenient, the hours aren't there. We have families that are working 2-3 jobs, they can't get access to care. How do we make those things come together?
Some of the rural counties in the state, the problem is that they're not close enough to a healthcare facility. How could you improve that if you were elected to some of the more rural Hoosier residents that they're able to get to a facility, like you said,
Right.
to get access to that healthcare?
Right, so we were just talking about how a third of our counties don't have a place for women to deliver a baby. And so we know that healthcare is lacking in the rural communities. We have to look at different ways of delivering healthcare, right? I'm imagining that instead of big, large hospitals with 100 beds, right, which is extremely costly, we now have in Granger, we have a small hospital that has a handful of beds, but are able to take care of people that are in Granger and to the east of Granger. Can we start looking at smaller hospitals, right? Instead of building big hospitals, can we have smaller hospitals or small medical centers that can take care of? And I imagine that we're going to, as a state, that we're going to have to invest in those. We can't just rely on the private sector to do that, but how do we enter into a public-private partnership to be able to deliver those kinds of things? I mean, you look at the VA, right? How does the VA provide care to veterans? We could look at that model and see how do we make sure that all Hoosiers have access to health care.
Mental health is another issue here in Indiana. Recent data from the CommonwealthFund.org shows that 28% of American adults over 18 are unable to receive mental health treatment. Here in Indiana, it's 39% of adults over 18 are unable to get access to mental health. How could you help that? Because that is a growing trend here in the state.
Yeah, it is. And there's been a lot of good work in St. Joseph County on this particular topic. And I want to say that our local government, our county council, pulled back on their support when we were trying to build a behavioral crisis center, right? Because right now, if you don't get access to mental health and a crisis ensues, who gets involved? It's law enforcement. And then things go sideways, and things horribly sideways. We needed a location where we could mediate that, right? Where we could mitigate the crisis, have the person in a safe environment and be treated by professionals. But our local government decided that was not where they wanted to invest their dollars. Here's the thing, in Indiana, we have money. We have a surplus. We have plenty of money to be able to invest in these kinds of things. It depends on whether or not people want to make it a priority. I want to make it a priority. There are plenty of people in Indiana who want to make it a priority. Another revenue stream that they've talked about is adding, was it a quarter to 25 cents to cell phones to pay for mental health services so that we can take care of this 39% of people. I mean, my God, 40% of Hoosiers can't get care for their mental health. What does that do to our economy? It's such a short-term outlook, right? When we don't invest in mental health. People not getting mental health care, that affects their education, that affects their livelihood, it affects their family, it affects their income and the economy. Then they're not paying taxes into the system either, right? It's a short-term view to say, oh, we don't need those things. We absolutely must have mental health services.
You mentioned how a lot of it falls on law enforcement a lot of times, and then we have a situation that does go bad at times where somebody dies as a result. Locally here in South Bend, the city has tried to get a response team together to start going out and answering the calls, but there's a lot of logistical issues. They're not quite sure how to get going. It's still not going here in South Bend. So if the city is having trouble putting this together, how can the state either help or put together something at a state level that could respond to these crisis situations?
Sure. So here's the thing, is that we have models in the country that are actually working. In Oregon, they have a program where officers are riding along, or social workers are riding along with police officers. And so they are responding to these crises with a mental health professional right there with them. So we have models in the country. What we need to do is look at those models and bring those models here to Indiana.
Education in the state.
Let's talk about that.
So according to data from the Indiana Department of Education regarding iRead scores, so far in 2024, 88% of white students have passed the exam, while 68% of Black and Hispanic students have passed. What is the root cause for this large gap between white students and minority students here in the state?
What is the cause for the gap between white and minority students reading? So we need to then talk about racism and institutional racism, right? This has got a really long history in education, that we marginalize minority communities. Minority communities tend to live near brownfields. There's environmental racial justice that we could be talking about. It's not just what happens inside of the school, but it's also how minorities have been treated here in Indiana, right? It's a very sensitive subject, and yet needs to be spoken about. We need to be openly talking about it. The tests that children take in K-12 are biased towards white individuals. That's in the research, right? And that children of minority tend to not do as well on those tests. So we're already setting them up, right? Children, they need far more support than they're getting, and we tend to be dismissive of their needs. Children come to school hungry, and yet we say we can't afford to give them breakfast and lunch. That's nonsense. Michigan just figured out how to do it. Minnesota's been doing it for a long time. Why are we not feeding our children while they're in school? Kiddos need food and water and so forth in order for that brain to work so that they can take in that information, right? So we could go down that neuroscience path as well, just as a humanity question. There are reasons why children are falling back, but the answer is not to be punitive. Now, my opponent, Dale Devon, voted for the bill that wants to hold back third graders when they're not reading at the level, right? That's punitive. That's punitive. Those parents are sending their best kids forward, right? And what Dale Devon's response to that is that if your child is not being successful, we're going to hold them back. Dale, that is not an answer. That is not an answer to what's going on. And here's the thing. We have models of success. Look at PHM school system, right? You look at their numbers, and their numbers are going to be higher. They're letting teachers do what teachers do best. They're the experts. They know how to teach kiddos how to read. And they're not the only ones. We have examples all over the state for that. And that's what we need to be investing in. Why in the world are we talking about holding kiddos back, but we're not having the conversation about investing in teachers? Why are we not having that conversation?
I would say that teachers in the state, according to the data, get paid less than teachers in other states around the country. That's one. But you mentioned, let's talk about school choice. So there are oversized classrooms as a result of school choice. I know for a fact that some students, some classrooms in the New Prairie School District have larger class sizes because they're taking kids from the South Bend District, from the Leidick area. In the city of South Bend has lost students, even one school closing down as a result of this school choice. Is school choice part of the problem as well? Because now there's less resources going to inner city schools like South Bend, and their graduation rates are lower than somebody's outlining.
Right. So school choice is definitely part of this problem. And again, Dale Devon, my opponent, voted for school choice and continues to vote to expand school choice. I think what the audience needs to understand about school choice is how much money, our public education monies, are being put over to support private schools. So in the last 7 years, well, let me say this, just in this past year, $1 billion of public money, that's our taxpayer money, $1 billion, are now going to families to help them to pay for private school that they were already paying for. $1 billion. In the last 7 years, PHM has lost out on $14 million because those dollars are being pushed to private schools. Mishawaka has lost $7 million. I'm sure both of those school systems could do a heck of a lot with those dollars. So yes, school choice is part of the problem. And Jennifer McCormick has talked about raising teachers' wages, and I'm 100% behind her, and she has set that mark at $60,000 a year, and I wholeheartedly support that. I talk to teachers at the doors all the time when I'm knocking on doors. The teachers have been victimized and villainized, demonized in our community, in Indiana, and Dale Devon has been right there with them, victimizing our teachers, and it's enough.
I'm glad you brought up private schools because I do have some data here I want to share with you. From the same resource. The data shows that public schools in 2024 so far regarding the iRead have a 19% failure rate, while the non-public schools have less than 8% failure rate when it comes to iRead scores overall. Is giving access or vouchers to students in impoverished neighborhoods, maybe some minority neighborhoods, access to those private schools that are showing higher scores with iRead, is that a solution, or do you think privatization of schools is a problem? Because the scores so far this year show that it is better than public.
So that data inherently is questionable. And the reason I say that is because private schools can choose who come into their schools. A public school is required by state to take all students and welcome all students. Private schools do not have those same rules. Public schools have to do all kinds of reporting and have to respond or have the students take all kinds of standardized tests. The private schools do not. We can't compare the private and the public until they are on the same standards. So while they're reporting these iRead scores, their populations are completely different. So it's not a fair comparison. It's not apples to apples. So I have an issue with trying to compare these two bodies, private versus public.
The amount of students is more in public schools than private schools. There is a big difference in how many students do go to those schools. So I understand that point.
Yeah.
But would you be willing to provide vouchers to students from disadvantaged communities to attend private schools if they wanted to? Because some may look on the outside in saying, it might benefit my child to go to a private school.
Sure.
Would that be something you would consider?
So here's the thing. When Mitch Daniels, former Governor Mitch Daniels, proposed this whole school vouchers business, it was supposed to be for people of low resources that they were currently attending a public school and their current school was failing. And it was an opportunity for the parent to make a decision and a choice. Do I want to stay here or should I go somewhere else? That was the original plan. And frankly, most of us were like, that seemed reasonable to us, because why should your zip code or your, determine where you have to be and you have to stay in a failing school? That seemed reasonable. But now what we have is we have families who are making $230,000 a year who can now take voucher money, having never gone to a public school, and fund the private school that they were already paying for 2, 3, 4, 5 years ago. That's not okay. That's not okay.
I want to shift to marijuana legalization. This has been talked about. Ohio, Illinois, Michigan, all legal.
Right.
There's a lot of money that the state is bringing in that they could provide resources to their residents. Indiana is still illegal to have marijuana.
Right.
What would your stance be with legalizing marijuana here in the state? Business opportunities, what would your position be?
Yeah, my position is that we need to legalize marijuana. We're behind on this, and our state has lost a tremendous amount of revenue. And here's the thing, your earlier question was, how could we fund healthcare in Indiana? There's your answer. There's your answer. When we're selling cannabis, you can have a tax on it so that helps to fund healthcare in Indiana. We're missing out on that. We're missing out on business opportunities. People are leaving the state all the time to get cannabis elsewhere. I'm also not talking about some sort of reckless implementation. I want to be able to look at other states and see what's been done well, and particularly when in regards to medicinal cannabis, making sure that people who are critically ill, and that could be a really helpful saving factor for them for quality of life, we need to make sure that we do that as well.
I'm glad you touched on the allocation of the tax dollars. Now, would that be something that you would put into a bill to say all the money, the tax revenue that is generated from legalization of marijuana goes to specific things, or is it just that the state could spend it wherever it needs it? Like, how would you allocate that
money?
That's
a good question. So as I think about that, I kind of compare this to the cigarette tax, right? That's how I would create that parallel between those two things. So the cigarette tax, as part of that tax, does go to healthcare and public health. Having said that, I'm also in favor of raising the cigarette tax. Indiana hasn't raised the tax in, I believe it's over 10 years, and we are far, far behind others. And this is another way for us to be able to generate revenue to pay for public health and healthcare for Hoosier families. And more importantly, to expand, as you mentioned, expand healthcare into the rural areas. It's going to require a public-private partnership to make sure that we've got healthcare all over Indiana. And this is the way that we can do it. This is the way we can do it. We're already spending those monies. We already leave the state to go buy marijuana. Let's do it here in Indiana. We keep our taxpayer money here in Indiana so that we can provide healthcare and other things for Hoosier families.
I want to shift to the development here in St. Joseph County, where your district sits in. Mm-hmm. Some of the largest investments in Indiana history have been made over the past couple of years here. There's a development including the Amazon data center that is going to consume a lot of energy. A lot of people are worried about how much of a drain it's going to have on the power grid. Cost for electricity right now is high and is going up here in Indiana. How do you come in, if you get elected, and help give some of the residents relief? Because inflation's up, people are paying more money for their groceries, and electricity keeps going up. Yet we are continuously developing solar power here in the state. You see more solar power being added to what used to be farmland. So where do we fix this to lower the costs?
How do we fix this? Okay, so this is a problem that's been generated over a long period of time, not easily solved, right? But here's the thing, is that Dale Devon and his fellow Republicans have been giving the energy companies all kinds of leeway to pass the costs on to the consumer. Every time they need to make an upgrade, do something different at their plants, they come to the State House and say, is it okay if we add 10 cents this time? Is it okay if we add 25 cents this time? And I'm talking 10 cents every month for everybody who's consuming electricity. It adds up. Then they come back and say, I need 25 cents because I've got to upgrade this grid. And Dale Devon signs on the dotted line, and Duke Energy, they walk into the State House, they ask for more money, and they pass that on to the consumer. And so this is why we are paying so much more. Why we are paying so much more. The Republicans have allowed the electric companies to pass on all their costs to the consumer. When we think about now the investments that are being made in Granger and then out in New Carlisle with these new facilities, they are going to be a drain on our electrical grid. This is not my area of expertise, but I'm willing to listen to the people who have the expertise to talk about how do we solve these problems. We are a data-driven society, and so we need more power all the time. What are the best ways to deliver that, and how can it be cost-effective, and how can we alleviate some of those costs? I would say that Indiana has had a surplus for a long time. In the billions of dollars, we've had a surplus. We also have a really high gas tax here in Indiana. We're the 5th highest in the country. Indiana, 7 million people. Why are we the 5th highest in the gas tax? We pay 56 cents for every gallon of gas that we buy. We could have real relief today if the Republicans and Dale Devon had decided to do something differently. But they didn't. But you know who got a break? The people who own private jets. That fuel no longer has a sales tax on it. So if you own a private jet and you fuel up, your sales tax will be 0. But I go over to my gas station and I pay 56 cents on every gallon of gasoline. We could have real relief right now. So I hear what you're saying about we've got high electric bills. We absolutely do, and people are talking about it at the doors. This is why economy is top of the mind for me. But we could have real relief now if we would reduce this gas tax. Why are we the 5th highest in the country?
And besides the tax, there's a push for more electric vehicles. One of the plants that is getting built is a GM plant that's going to be building batteries for electric vehicles. That's also going to take that drain on the power grid. It seems like there's a lot of development, but there hasn't been a plan in place to help alleviate and provide this energy. So people are questioning, where is this energy going to come from to do all this? And you, if you are elected as a representative, how are you going to vote on issues that, when it comes to their increase in 10 cents, 25 cents, like you said, how would you vote on that?
Right. So let's go back to the first part you talked about. It's what's the plan look like, right? So we have these plants that are going up. There's a district down around Lafayette, Indiana, called the LEAP District, where a huge plant is going in and is going to be a huge drain on the aquifer there. That's the same thing that's happening in New Carlisle. That's what the protests have been about, is what's going to happen to their pristine aquifer. We ask these questions. We try to ask Dale Devon, what's the plan? Where's the long-term plan? Who's done the vetting? Who's done the environmental studies? Do you know what we get? Nothing. Dale Devon is hiding from us. I'm his constituent. I have every right to ask Dale Devon, why did you vote for this? Where are the studies that show that this is a safe thing, or that you're going to mitigate the problems that may arise in the future? I'm his constituent, but he's hiding from us. We can't get answers to these questions. When I'm elected, I want to be that candidate who's available to my constituents. I put my cell phone number everywhere I go. It's on my walking pieces, it's on my website. People can get a hold of me when they need to get a hold of me. And that's the way it should be. But right now, we have all this building going on, and our government officials can't answer for it. We don't know if sidewalks are going in. We don't know what improvements are going to be made. We don't know what the noise pollution is going to look like. We don't know what the light pollution is going to look like, because they've just shut down. They don't come out. They're hiding, and they don't come out and tell us what's happening. It creates a real environment of distrust. Families are telling me they don't understand why it's happening. Why is this happening in Indiana? But we can't get answers. And so everybody has become so mistrustful. And I want to bring that trust back. And people know me, because I've been doing public education and public health now for almost 35 years. And I was the president of the St. Joseph County Board of Health, had open meetings, have met with community leaders to problem solve things. So they know that I'm a trusted leader, that I'm open, that I want to negotiate, I want to problem solve, and I know how to do those things.
Now, I think we've established the need for more energy, especially with all the development in our last question. But there's been a pushback on solar farms being developed in some of the rural communities. Most recently, North Liberty have locally voiced their opposition to more solar power. So how do we diversify and increase energy sources in a state where there's pushback against it?
Yeah, I think it comes, really, I think it's about education. It's understanding why we need to have these alternative sources of energy. I was driving through my district and I saw brand new, huge utility poles going in, cutting through forests. And that's because we have to bring in more power to power these data centers, right? We've got to have alternative forms of energy. We can't just rely on one form. We won't survive that. So we need solar farms. How do we educate people about that? How do we show them the benefit? How do we show them that maybe it will actually lower some of our utility costs because we now have other forms of energy? So again, we need to bring experts in. We need to do education, hold town halls, share with people what it is that we're doing, what we're planning, and why we're doing it.
So would you vote to approve more solar and potentially even wind as an alternative, or to help diversify our energy portfolio?
Yeah, I would vote for diversification for sure. Do we need more wind farms or more solar farms? I can't say that from sitting from this vantage point. But yes, I mean, if we're going to move into the future with climate change the way that it is, we have to diversify our energy sources. And so yes, I would vote for that diversification.
Is there anything else that you think the voters need to know about you and how you would represent them if elected on election day?
Yeah, the things that are incredibly important to me and to my constituents when I'm out knocking on doors. They talk about that they want higher wages, totally support that. They want to see women's rights restored, and they want a fully funded, high quality public education system so that when they put their kiddos on the bus, they know that they are safely going to a place that's going to nurture them and educate them, and that they will return safely in the evening. Those are the three things that I'm uber focused on. And this is almost exclusively the things that people are talking about when I go and knock on the door and talk to them. Dale Devon, on the other hand, is not talking about these things. We've asked him to come out for a candidate forum. We want to be able to do a debate. I can't reach him. He's hiding from his record, which creates mistrust. And he's hiding from his record because it's extreme. And it doesn't have to be this way. We don't have to live in a state with such extremism. We can vote for people who have common sense, who want balance, who want compromise, and we can solve these problems. Indiana has the means to solve these problems. But we need people who want to do those things. The choice in 3 weeks, this election is in 3 weeks. The choice could not be more clear. Dale Devon represents an extremism point of view. I, on the other hand, am common sense, focused on increasing wages, restoring women's rights, and funding public education. That's what I want to do for Hoosiers.
Thank you for sitting down with me, Heidi. And if you do want to vote November 5th, and early voting has started. So what do you have to say to the early voters?
Yeah, get out and vote. Early voting has started, and we're seeing approximately 1,000 people per day going for early voting. So it's fantastic. People are excited to vote this year.
Well, thank you for sitting down with me.
Thank
Appreciate
you.
it.